From Wisconsin Institute of Functional Medicine. Hi, doctor.
Hello.
Well, great to have you back.
Thank you.
So we're going to talk about Women's Health Week, and maybe we should dive into the origin of that, when that is.
Yeah, so it starts on Mother's Day, perfect time, and it runs through that whole week. It was originally started to create awareness around women and girls and making their health a priority.
Yeah, and there's a couple things that really stand out when we talk about women's health. We talked earlier, cardiovascular disease, diabetes. Let's get into why those are such problems.
Yeah, so of course men can have cardiovascular disease and diabetes, but it's different for women. Women don't always present exactly the same way, especially if they're having a heart attack. A lot of times they'll present with nausea, they might have periscapular pain, so they're just not as aware that they could, and women are notorious for just brushing it off. Same about diabetes, it increases their risk for cardiovascular disease by 4 times just because they have the diagnosis of diabetes, so different than men. And then why do we care about it is because we want to do a deep dive and test their cardiovascular health. So we typically will do a lipid panel, that's what you most often get, but we go a little bit deeper than that, especially if you've had a family history of someone who's had heart disease. So we do what's called a cardio IQ, and basically the lipid panel is like the preview to the movie. Cardio IQ is all the characters, you get to know if you have the bad markers or good markers, and are you higher risk? Do you make big fluffy ones that we don't care about, they bounce off the walls, or do you make small ones that create plaques?
And based on those markers and what's going on, you then have a precise plan to treat what's going on, instead of maybe we just look at the lipid panel and we hope.
Exactly. So a lot of times you'll hear your ratio is good, so your HDL to LDL is good, and so we'll think, okay, our patients are safe. But really, if they have some of those other risk markers, then they're really not safe, and we really need to educate them on what they need to do, modifiable lifestyle changes, food, supplements, and even sometimes medication.
Yeah, and a lot of your patients, probably because of the deeper dive you've shared, have really benefited from that.
Yeah, so especially when you have that family history of heart disease, you can prevent a heart attack by knowing this information.
Yeah, well, those are good things,
yeah,
right?
They're really good things.
And when we've talked to some of your patients before, let's just tell people, because this is a bit more deeper than maybe you're going to get with going to just general medicine.
Yeah, and I would say we always want to do a lipid panel because that's the first step, but then we do the deeper dives, and that's what personalized medicine is all about. Like, what does your family history, what's going on with you, and then what should we do to look a little bit deeper?
Well, Tracy, thanks so much for being here and
Thanks
keeping us
me.
healthy. You betcha. And we want to thank you for watching.